How to increase your chances to get pregnant? A question many couples are looking for an answer. First one. Record menstrual cycle frequency. Second thing is to monitor ovulation. Third thing is have sex every other day. Fourth thing is strive for a healthy body weight. Fifth thing is take a prenatal vitamin. Sixth thing is eat healthy foods. Seventh thing is workout. Eighth thing is be aware of age-related fertility declines. Ninth thing is kick the smoking and drinking habits. And last thing is know when to seek help. First one. Record menstrual cycle frequency. A woman who wants to have a baby should monitor whether the first days of her periods tend to occur the same number of days apart every month, which is considered regular. Conversely, her periods may be irregular, meaning her cycle lengths vary from month to month. By tracking this information on a calendar, a woman can better predict when she might be ovulating. This is the time every month when her ovaries will release an egg. A woman's egg is fertile for only 12 to 24 hours after its release, while a man's sperm can survive in a woman's body for up to 5 days. Second thing is to monitor ovulation. Women with regular cycles ovulate about 2 weeks before the arrival of their periods. It's harder to predict ovulation in women with irregular cycles, but it usually occurs 12 to 16 days before the start of her next period. There is a wide variety in the lengths of cycles of people who menstruate, so it is best to monitor ovulation to find out when the person is most likely to conceive. There are several methods women can use to help determine their most fertile days each month. Home ovulation prediction kits. Another method to predict ovulation is to track cervical mucus. Basal body temperature is also a good way to monitor ovulation in most cases. Third thing is have sex every other day during the fertile window. The fertile window spans a 6-day interval, the 5 days prior to ovulation and the day of it. Every month, a woman is most fertile on these days. Many women are turning to new technology tools, such as fertility tracking apps and websites, to help them keep tabs on when they may be more likely to conceive. Side note: there are some water-based vaginal lubricants that can decrease the movement of sperm. Fourth thing is strive for a healthy body weight. A woman's weight can also impact the chances of conceiving. Being overweight or underweight may reduce those odds. Research has shown that a woman who is overweight can take twice as long to become pregnant as a woman whose body mass index, BMI, is considered normal weight. And woman who is underweight might take 4 times as long to conceive. Having too much body fat produces excess estrogen, which can interfere with ovulation. A study suggested that couples in the study in which both partners were very obese, with BMIs of at least 35, took from 55% to 59% longer to become pregnant, compared with couples who were not obese. Male obesity, which can disrupt the male endocrine system as well as sperm viability and concentration, can also affect a couple's ability to become pregnant. Women who are underweight, with a BMI less than 18, might not be getting regular periods or could stop ovulating, which also hinders their ability to become pregnant. Fifth thing is take a prenatal vitamin. Women who are attempting to conceive start taking a prenatal vitamin even before becoming pregnant. This way, a woman can find one that's more agreeable to her system and stay on it during pregnancy. Another possibility is to take a daily multivitamin, as long as it contains at least 400 micrograms, mcg, per day of folic acid, a B vitamin that's important for preventing birth defects in a baby's brain and spine. Sixth thing is eat healthy foods. Eating a variety of healthy foods can help prepare a woman's body for pregnancy by giving her adequate stores of critical nutrients, such as calcium, protein and iron. This means eating a variety of fruits and vegetables, lean protein, whole grains, dairy and healthy sources of fat. Besides taking a supplement containing folic acid, a woman can also obtain this vitamin from foods such as dark green leafy vegetables, broccoli, fortified breads and cereals, beans, citrus fruits and orange juice. Also, some science suggests that pregnant women should avoid caffeine. Health authorities in the United States, Europe and the United Kingdom said that a woman having about 200 milligrams of caffeine, less than 2 cups of coffee, will not affect her baby. Seventh thing is, cut back on strenuous workouts. Being physically active most days of the week can help a woman's body prepare for the demands of pregnancy and labor, and has been associated with a reduced risk of fertility problems. But getting too much exercise or doing frequent strenuous workouts could interfere with ovulation. Doctors see a lot of menstrual disturbances in women who exercise heavily, and a lot of times these women need to cut back on their workouts if they want to become pregnant. Eighth thing is, be aware of age-related fertility declines. As women get older, their fertility decreases. This is because of age-related changes in the ovaries that cause a decline in the quantity and quality of her eggs. There's a gradual fertility decline in women beginning in their 30s, a sharper decline after age 37 and a steep fertility decline after age 40. These declines mean that it may take longer to become pregnant. With advancing age, there's also an increased risk for some health problems, such as uterine fibroids, endometriosis and blockage of the fallopian tubes, which can contribute to a loss of fertility. Ninth thing is, kick the smoking and drinking habits. Smoking can lead to fertility problems in both women and men. Chemicals found in cigarette smoke, such as nicotine and carbon monoxide, speed up the loss rate of a woman's eggs. Smoking ages a woman's ovaries and depletes her supply of eggs prematurely. It's also a good idea for women to stay away from secondhand smoke, which may affect their chances of becoming pregnant. It's safest for a woman to avoid alcohol when she is hoping to become pregnant. A woman should also stop consuming alcohol if she stops using birth control because she wants to get pregnant. Drinking alcohol at moderate, 1 to 2 drinks per day, or heavy, more than 2 drinks per day, levels can make it difficult for a woman to get pregnant. Once a woman becomes pregnant, there's no safe amount of alcohol. And last thing is, know when to seek help. Both the woman and the man should consider having an infertility evaluation if the woman is 35 or older and has not become pregnant after 6 months of having sex regularly without using birth control. Also, a woman who is under 35 and her partner should consult a fertility specialist if she hasn't become pregnant after 1 year of having unprotected intercourse on a regular basis.